My name is Kara Conroe, and I am a student in the ASU course, The Criminal Mind Psychology course, and in this video I would like to talk to you about psychopathy. Mainly, I would like to speak about what psychopathy is, the factors that contribute to psychopathy, if it can be assessed, and treatment options, and things like that. So, to start this off, we will discuss what is psychopathy. Many people have heard the term psychopathy or the word psychopath, and there are many misconceptions about it because of how it's viewed in media and things like that. So what does psychopathy really mean? What is a psychopath? And an article that I found that really sums this up pretty well is the article Symptoms and Main Features of Personality Formation of a Psychopath, and it describes it as a personality disorder that it forms really early on in your life, and it develops throughout childhood and adolescence, and then it can lead to further criminal behavior later on in life due to other factors, which we'll discuss later. Another thing I wanted to mention in this section of the video is the common misconception that sociopaths and psychopaths are the same thing, which during my course at ASU I learned was not exactly the case. In fact, sociopathy is not currently viewed exactly as a disease or a mental illness, in itself. It has been re-qualified as ASPD, antisocial personality disorder, and it is not exactly the same as psychopathy. And in fact, all psychopaths are not they do not all have ASPD, and all people that have ASPD are not all psychopaths. So they are two different things. They're not exactly the same. Now, moving on to the factors that contribute to psychopathy. There are biological factors, genetic factors that a psychopath is born with that can contribute to psychopathic behaviors. And there are also environmental factors. And the genetic factors can be, as the article, early environmental predictors of the affective and interpersonal constructs of psychopathy. It states that factors contributing to psychopathy are structural and functional brain impairments, which these are genetic traits that are in psychopaths' brains. So this is something that they're born with that can affect their behavior and the way they feel or don't feel things. But that article that I just mentioned focuses mainly on the environmental factors, which are things like childhood maltreatment. So that would be sexual, physical, or emotional abuse during a person's childhood that can contribute to psychopathy and lead to psychopathic behaviors and criminal behavior in the future. It doesn't mean that it doesn't guarantee that a person will have psychopathy or will engage in psychopathic behaviors in the future. It is just a factor that can contribute to it. Moving on to the next topic I'd like to discuss is assessment for psychopaths. One of a psychopath's traits is that they are very manipulative, and they are very good at putting on different faces and coming off as the person they would like you to view them as. They're very good at putting on masks and faces and personalities and manipulating people. So it can be difficult to assess psychopathy. One article, How to Spot a Psychopath, Lay Theories of Psychopathy, offered a study that showed that when a group of people was given a test to determine if people had psychopathy or several other mental disorders, it was difficult for them to identify the psychopaths that they were shown or introduced to compared to other mental illnesses like depression or schizophrenia. So it is difficult to determine if someone is a psychopath. However, we do have assessments such as the PCLR, which we can use to determine if someone is or isn't a psychopath. After assessment, though, we come to treatment options, and many people are very skeptical. They don't believe that psychopaths can be treated, and this is a reasonable concern because, like I previously stated, psychopaths are very manipulative, and they can put on faces, so they can make it seem as if though they are responding well to treatment, when in reality it just benefits them at the moment to assume the personality of someone who's being treated, and they aren't really taking in that treatment. So it can be hard to tell if we're actually treating a psychopath or if they're acting and fooling us. So because of that, many people are skeptical. However, there are some options that target brain functions. One article is also skeptical of this, and it brings out many points of why trust in these options are misplaced, but it does discuss the options themselves. The article is To Treat a Psychopath, and I'd like to read a quote from it where it says, "Some people are now quite optimistic about the possibility of treating psychopathy with drugs that directly modulate brain function. I argue that this optimism is misplaced." So this article shows the skepticism, the common skepticism with treating psychopathy, but as it brought out, there are options where people are looking into treating psychopaths by altering their brains directly. This does bring us to, however, if treatment isn't working, how to handle with psychopaths, because if it's not working, a trait of psychopathy is that they don't feel any remorse or guilt. So if they don't feel remorse or guilt for something, they might go on to repeat the same crime or do a different crime or continue committing crimes and engaging in criminal activity because they don't feel that remorse or guilt, which the article, The Guilt-Free Psychopath, goes into this deeper. But this can lead to, like I said, repeat crimes, so it's very important to make sure we're really getting to and really treating psychopaths if there are reliable treatment options. Thank you so much for staying with me throughout this video, and that is all I will discuss on the topic for today. Thank you.